Advanced diagnostics is what is used in this practice, utilising objective, reproducible test procedures. We have many point-of-care tests here that test for and screen for many disease states. Celiac disease is one, candidiasis is another common problem. Heavy metals we also screen for heavy metals, an increasingly common problem these days as we're finding heavy metals dispersed around the planet. We're breathing it, we're drinking it, and we're finding it in our food chain as well. Other procedures that we regularly utilise at the practice is blood glucose testing, cholesterol lipid testing, testing for oxidative status. Oxidative status test gives us wonderful information about the possibility of underlying toxins and poisons that drives free radicals, which then go on to drive the oxidative process. Oxidative process underscores many known disease states. A very simple test procedure we use for this, and it's reproducible and very much easily resolved with simply with antioxidants. Blood microscopy is another tool that is regularly used at the practice. It's an invaluable tool that enables us to determine many different features of a dysfunctional health state. Hands-on physical assessment is a very important part of the diagnostic workup at Coma Natural Medicine. We regularly, in fact for all new patients, we palpate their abdomen, take blood pressure, look at ear, nose, throat, conditions which can often and frequently underlie a low-grade or cause a low-grade infection in the system, which could then lead on to further disease processes or prolongation of disease processes. Locomotive function is very important, palpating the spine, joints, looking at skin, hair, nails, tongue, also very important part of the diagnostic workup here. Food intolerance testing is another interesting aspect we've been utilising the practice over the last 12 months, and situations that that have been very slow or difficult situations to where improvement has been slower than what we'd generally believe to be the case. We're often finding now that food intolerance underlies that. We've been aware for many years here of wheat and commonly wheat and dairy intolerance, but since we've been doing further food testing, which involves testing 44 other common food groups, we're discovering that there are many other food intolerances that are very commonly underscore health problems. Another interesting test procedure we've been using the last year or so is genetic testing. This has enabled us to look at the inherited strengths and weaknesses of our gene pool, and gives us an understanding of where to focus therapeutics so that we can dramatically reduce the possibility of disease occurring. Thus, diagnostics is an absolutely essential part of the workup of and gaining an understanding of our clients' health, and also for maintaining our clients' health, which is of paramount importance.